You've taken the positive pregnancy test. You're super excited. And then you're like, well, WTF? What am I supposed to do now? Let me tell you. And I want to note that this video is primarily geared to those who have been trying to become pregnant. So if this pregnancy is a surprise, take a deep breath, get some privacy so you can process the pregnancy, and then discuss your options, with a trusted loved one or loved ones you feel comfortable discussing this with, and then move forward from there. All right, but back to those who have been trying to get pregnant or are, really excited by this, who instantly know, okay, I wasn't trying to become pregnant, but this is great news. I know immediately that this is right for me and I'm going to move forward with this pregnancy. So first, if you're having the baby with somebody that, is going to be your life partner or already is your partner, it can be fun to tell them in kind of a fun way. You don't need to do like a super elaborate TikTok worthy baby announcement for your partner, but it can be fun to tell them in a clever way. And I think I'm going to make a video about, different ideas for how to do that. But in the meantime, just Google it and you'll get tons of ideas. All right, celebrate. Oh, wait, I want to go back to the tell your partner. Okay. One thing that can be fun, and I'm not saying to do this for social media, although you can post it, but it's kind of fun to like secretly record your partner's reaction. So like what I did is I just set up my cell phone in an incognito place and kind of like when I told him, made sure he was standing somewhat in the frame because it's just kind of sweet to have that for posterity. And again, obviously you can post that if you want, but you don't have to. Next, celebrate, yes, fears of complications, pregnancy loss, they are all absolutely valid. But you should also really let yourself lean into the joy and the excitement that can come with that positive pregnancy test, and know that you are not jinxing yourself. Allowing yourself to be happy for this pregnancy is not setting you up for a loss. Allow yourself to savor these early moments after you take that test. Make sure to start taking a prenatal vitamin. If you've been trying to get pregnant, you might have been taking this vitamin for a long time. But if you haven't, make sure to start taking that prenatal vitamin ASAP, especially to make sure you're getting the folic acid. That is one of the most essential parts of the prenatal vitamin for pregnancy. If you haven't already, cut out alcohol, drugs, smoking. If you're on prescription medications, talk to your care provider about what is safe to continue. Obviously, if you feel like, you're addicted to alcohol or any drugs or anything like that, talk to your care provider and they can support you in making a plan for, working through that addiction in a safe way for the pregnancy. Next, decide who you want to tell. While you have every right to immediately call everybody that you know, to post on all of the social media platforms, to put a picture of your pee stick on Twitter, some people, they might want to wait a little bit. So just like give yourself a beat, take a deep breath, and then decide what feels best for you. Who do you want to share it with? And if it is to absolutely everybody, then that's great. Do it. All right, next, call your doctor. Or if you see a midwife for, your healthcare, call your midwife, call whoever your healthcare provider is. And likely, they won't need to see you until nine weeks gestation, unless you have any special circumstances that come up like bleeding or pain. It can be nice to just go ahead and schedule that appointment, give them the heads up that you are pregnant. Again, same goes for that midwife. And if you're not yet sure, say you're seeing an OB, but you might want to see a midwife, eventually go ahead and schedule that initial appointment with your primary care provider, knowing that you can change later. Of course, if you know a midwife, you know this is the person I want to use, obviously you can start with them right away as well. But essentially what I'm saying is whoever you first see does not need to be the person that delivers your baby. So you can see your OB for even the whole first trimester and then switch to a midwife later on, or vice versa. Like for example, I switched from my OB to a midwife around 14 weeks. Even though my OB is the most amazing person on the planet, I really wanted a home birth, and he can attend home births. But I love my midwives too. They're great. I had an awesome birth team. More on that in my birth video and all my other videos. All right. Consider any special health circumstances you might have, because you might need to work with your care provider to adjust your treatment. Next, make an appointment with your dentist. A lot of women are surprised by this one because dental issues can actually have a pretty significant impact on the health of your pregnancy. So it's important to make sure you're up to date with your dental care. Evaluate your work duties. If your work exposes you to certain toxins that could be harmful to the baby, you might want to ask your employer if your work duties could shift so you're in a safer area. Or if you're waiting for pregnancy to quit, go ahead and put in those 2 weeks notice. Next, if you have experienced pregnancy loss in the past and you're feeling really, really anxious to confirm the heartbeat, you can call your care provider and ask if they can give the go-ahead for an ultrasound at 6 weeks. And a lot of times they put in an order for the ultrasound. Most doctors don't have a sophisticated enough ultrasound machine in their office to detect the heartbeat that early on. But if they send you to a hospital or a specific clinic that almost just primarily does ultrasounds, they can probably pick up the heartbeat at 6 weeks. But with that said, if there's not a heartbeat at 6 weeks, it does not mean that it's not going to show up, so don't panic. And next, if you experience any abdominal pain, let your care provider know so they can rule out an ectopic pregnancy. That's really, really important. And last, make a to-do list, but remember that you have 9 months to complete it, so don't feel any rush. And you can also organize it by trimester. I have plenty of videos about essential to-do lists for each trimester. All right, well, make sure to like and subscribe because that helps me continue providing this content, and ask me any questions in the comments.